Hello and welcome to Attention Central Texas. I'm your host, Charles Jenkins, and in the studio with me we have Dr. Edgar Trevino. He's the medical director of Nolanville Faith Outreach Clinic. Hello and welcome to today's show.
Thank you for having me on this program, Charles. I appreciate that.
Yes, sir. Dr. Trevino, tell us, let's just jump right into it and tell us why are you here and tell us about the clinic.
Well, the clinic is a clinic that offers comprehensive health care services. The inception of the clinic was first created back in 2019 in the hearts and minds of the pastors and leaders of the community and churches and volunteers that wanted to bring a clinic with healthcare services to be provided to Nolanville, as we know is a medically underserved population or medically underserved area, which lacks primary care services to a geographical area. We thought that the leaders had it right in terms of providing this healthcare services to this community because of the lack of access in many population groups. As you know, this has been studied for many years and decades, rather, even when I was a medical school student. Essentially, the disproportionate healthcare outcomes, even poorer healthcare outcomes in ethnic minority population groups, or even high-risk population groups. Notably the elderly, the children, migrant workers, Native Americans. And right now, even to this day, I mean, things are talked about with even what we're seeing in the vice presidential candidates debates on the rise of healthcare costs. But this was a monumental milestone, so to speak, to put this clinic and see where it is now. It's an amazing feat.
That's amazing y'all doing this. When is the projected date for the clinic to be open?
Tentatively, we have November 1st of this year as a projected date. However, we're having to go through the hoops and hurdles of getting the early processes of getting a program put into place with the immunizations, Texas Vaccines for Children, and then eventually the adult vaccination program with ASN by the department, Texas Department of Health and Health Services. They're going to be providing guidance for putting these programs in place. I am slated to sort of also guide other providers that are going to be there, volunteer workers from Baylor, Scott & White, that essentially are going to be there during after-hour work schedules. And we're going to be operating 4 days out of the month. So it's going to be every Monday from 4 p.m. to 11 p.m.
Oh, wow.
Yes. So kudos to all the healthcare workers that are volunteering after during their regular workday to provide, healthcare there. And
you said something that was I found to be very interesting for me. 2019, and now it's just coming to fruition.
Correct.
5 years later. I think that is paramount for people watching that, hey, something can be birthed here, but you see the fruit of it come out here. So that is pretty cool.
Yes.
And you talked about the need for this. In your opinion, why is this so vital to that community? I know you touched on some of the other things, but I'm just saying that to see if you want to expand on anything. Why is this vital for Nolanville right now?
I think it's very vital that we are a beacon of hope and a community of healing in terms of providing medical personnel like myself and these volunteer workers, because I think it takes a village, right? And it also takes the spiritual partnership and commitment that we have in making that difference for each member there in Nolanville, because I think everyone has a right to quality healthcare access, but not only quality, but personalized, almost a spiritual, personalized, quality healthcare access and services, because I think this, in the longer scheme of things, is going to improve longevity.
Yes.
And I've always been a proponent of preventative health. I have a master's in public health, and interventions and prevention is almost key to cut down the cost of healthcare long term. You know, we don't have to use the ER, the emergency department, or urgent care clinics as a revolving door. We don't have to. We have to educate and counsel our patients. You know, when they go there, some of these patients, which I just found out, had not seen a physician in more than 40, sometimes 50 years.
Oh, wow.
And so this came about through a survey that they did there in Nolanville of 500 households. And about 25 regularly saw their doctor, whereas 475 did not see a physician or a doctor or provider in more than 40 or 50 years. And so these are staggering numbers that essentially puts the focus on primary care services such as Nolanville Faith Outreach Clinic. And we believe in the mission statement, which essentially allows us to be a team of a community of churches and volunteers that carry out the healing or the compassionate healing ministry of Christ by providing personalized quality healthcare services to the greater Nolanville and Harker Heights area. You
said something that was, I think it was prophetic to me. Spiritual partnership. I've never heard it put that way, and what greater way to do it. You know, Romans 12:4-5 say, we are many members in one body, but all the members do not have the same function. So we being many are one body in Christ and individually members of one another. I love the picture of bringing people together for one purpose, to serve what a better way to serve the community than people stepping up, volunteering, and having a doctor oversee everything that goes on in the clinic to make sure it's done right. Correct. No, and just to add on to what you just said, Charles, I think it requires that type of spiritual partnership with the community and then the neighboring counties, because then we could also be a role model for other counties to emulate a similar, safety net of a free clinic that we offer patients and the community members free checkups, physical exams, vital signs. If you're a diabetic, you can have your sugars checked there. We do medical management of chronic conditions, but it's to promote and manage health. With the idea of preventing unnecessary disability and premature death. This is ultimately the long-term goal for health equity for all Americans, not the high-risk population groups that we would normally see, and that we have studied and known about. But this hopefully closes the health disparity gap that we see nationwide. But I'm only doing this as the Lord has given me the gift of healing. And we should utilize our gifts on this earth to help those that are in need and that can't help themselves. You see me over here shaking my head as you talk, because I'm like, man, this is so needed. Think about somebody has to pay electricity bill, a water bill, or pay for my health. They're going to choose those two because so you're taking one obstacle away from people. Man, I can't pay to go see no doctor. And I just truly love what you guys are doing. Where will the clinic be located? We know it's in Nolanville. Do you have an address or anything? It's going to be on Main Street, right in front of the fire department. Oh, wow. What a perfect station. Spot. Yes, it is a perfect spot for that. So I'm hoping that, people go there and they're engaged with us. Again, it's a spiritual partnership, not only with the Nolanville community, but other neighboring counties such as Killeen. We like you said, alluding to your previous comment, they're going to choose the basic essentials before they choose to pay for insurance coverage to cover medical or dental. It has become insurmountable
in terms of the cost that we're having to deal with. So they're going to pay for groceries or gas before they even consider to go to get a physical or a checkup or blood work to see if they have any new onset of medical conditions. Now, as a physician and working at Seton Medical Center, I did see a lot of these patients having to wait for many, many months, even when they did have medical insurance, to see a primary care provider or even a specialist or a subspecialist. Now, again, I'm speaking within a microcosm of what a macrocosm of what we're dealing with nationwide. I mean, this is just not, in a vacuum that we're talking about this, lack of healthcare access.
Wow.
This is happening nationwide, and so we're kind of trying to bridge the gap there and allowing our partners in the community with, with the community church leaders and City Council and the City of Nolanville, allowing us to, have this beautiful opportunity to engage, with the people there in Nolanville and actually have them trust us again, and as a medical community, and know that we're there for them in so many ways, not just spiritually, but we're there to partner with them so they can have a healthier outcome.
Well, Dr. Trevino, we're running out of time, but this would be a great conversation for you to come on back and let's talk about it some more. But I don't want to leave without saying thank you first for what you're doing and stepping up for this job. But I also want to take some time for us to thank the beautiful folks who have volunteered and are providing resources to help you guys get this done. And we're going to play those on the screen for you.